Namaste, friends. Today we are going to discuss about joint movement in asanas. The understanding of joint movement is very important for the people who wants to learn yoga effectively and practice effectively, and those people who wants to practice yoga as a therapy. So joint is a part. Welcome, friends. We study about joint movements in asanas. So the understanding of anatomy, physiology and biomechanics pertaining to the joint movement is important for yoga teachers and the people who are interested in yoga as a therapy. Joint is a point between two bones which will help you for range of movements and flexibility. You need to know which joint is acting in that particular asanas and what direction it is taking from your body. For example, if I am taking my hand away from the body, it is called as abduction. If I am bringing my hand towards my body as a midline, it is called as adduction. If I am flexing at my elbow, it is called as flexion of the elbow. If I am extending backwards, it is an extension. If I am rotating my shoulders, it is rotation. If I am making my palm facing upwards, it is a supination. If I am making the palm downwards, it is pronation. So these are different terms which you are going to study and practice in joint movement. Why we are going to do all this is for making you to practice yoga effectively and prevent any sorts of injuries. For example, if you are practicing downward dog pose, just visualize and imagine the downward dog pose. If not, you go through the downward dog pose where the joints like shoulder joint and hip joint are involved towards the flexion movement, and elbow and the knee joints are involved towards the extension movements, where all the weight, all these four joints are involved in particular actions. Some are into extension, some are into flexion. It's very interesting to study. For example, if you are doing a warrior pose where you focus on quadriceps muscles mainly and the knee and hip joint, so hip joint will help you to align and more of the pressure will fall onto the knee joint. So these, if you are able to name the joint, if you are able to feel the joint, then you are able to practice the asanas more effectively.